Recently, Celine Dion touched everyone's hearts with her performance at the opening ceremony of the Paris Olympics 2024. The 56-year-old Canadian star's return to the stage is a historic moment for the music world, especially after taking time off due to a rare syndrome. The artist has been diagnosed with stiff person syndrome, a rare neurological condition that results in muscle stiffness and spasms. In today's video, we will explain what exactly is stiff person syndrome and discuss its causes and symptoms. At the end of the video, we'll share some important types of treatments to help manage this neurological condition. How to diagnose this disorder? What current studies reveal about this rare syndrome? Before we get started, don't forget to like this video, subscribe to our channel, and share it with your friends and family. Do you know anyone facing similar health challenges as Celine Dion? Where are you watching from? Let us know in the comments below. So, what exactly is stiff person syndrome? What causes it? And what symptoms should you look out for? Is there a way to effectively manage this health condition? Let's find out now. Stiff person syndrome is an autoimmune disorder that affects the nervous system. The key symptoms are muscle stiffness and painful spasms. For someone like Celine Dion, whose career depends on precise control of her vocal muscles, it's particularly devastating. The syndrome is so rare that it affects only about 1 or 2 people per million. That's part of why it's not well known. But for those who have it, it's life-changing. Celine Dion has described her experience with a medical condition, comparing the sensation to feeling strangled or having pressure applied to her larynx and pharynx. She has also mentioned that she sometimes experiences involuntary muscle contractions in her hands and fingers, particularly when engaging in cooking, which is one of her favorite activities. These muscle spasms can cause her fingers to become locked in certain positions, making it difficult for her to relax them. This gives you a sense of how the condition affects everyday life. Simple tasks become difficult. Things most of us take for granted, like walking or even just standing still, can be challenging for people with stiff person syndrome. The muscle spasms can be severe. Celine Dion said one spasm was so strong it broke one of her ribs. That's not typical, but it shows how intense the muscle contractions can be. For Celine Dion, the effects on her singing voice are particularly troubling. Unfortunately, these spasms affect every aspect of her daily life. These spasms make it tough for her to walk and, more importantly, mess with her vocal cords. Dion has shared that these issues stop her from singing like she used to. Singing isn't just her job, it's her identity. But what causes stiff person syndrome? The short answer is that we don't really know. It's classified as an autoimmune disorder, which means the immune system is attacking healthy cells in the body. But why this happens and why it affects the nervous system in this particular way isn't clear. There are some clues, though. Many people with stiff person syndrome have high levels of antibodies against something called glutamic acid decarboxylase, or GAD. GAD is an enzyme that helps produce a neurotransmitter called GABA. GABA is important because it helps regulate muscle movement. It's a bit like the brakes for your nervous system. When there's not enough GABA, the nervous system can become overactive, leading to the muscle stiffness and spasms seen in stiff person syndrome. But it's not as simple as just a lack of GABA. Some people with stiff person syndrome don't have these GAD antibodies, and some people have the antibodies but don't have the syndrome. So there's clearly more going on that we don't understand yet. Stiff person syndrome symptoms. One thing that makes stiff person syndrome particularly tricky is that symptoms can be triggered by unexpected things. Loud noises, emotional stress, even cold temperatures can set off muscle spasms. This unpredictability adds another layer of difficulty for people living with the condition. Imagine if every time you were startled by a loud noise, your muscles seized up painfully, or if feeling stressed could trigger muscle spasms so severe they could break a rib. It's not hard to see how this could lead to anxiety about going out in public or engaging in normal activities. In fact, some people with stiff person syndrome develop agoraphobia, a fear of open or crowded spaces. It's a natural response to a condition where your body might betray you at any moment in a public setting. Diagnosis of stiff person syndrome isn't straightforward. The symptoms can mimic other conditions, and because it's so rare, many doctors aren't familiar with it. It often takes years for people to get a correct diagnosis. There are a few tests that can help, though. Blood tests can check for those GAD antibodies I mentioned earlier. Doctors might also use electromyography, EMG, to measure electrical activity in muscles. And sometimes they'll do a spinal tap to look for signs of the condition in cerebrospinal fluid. But ultimately, diagnosis often comes down to ruling out other possibilities and recognizing the pattern of symptoms characteristic of stiff person syndrome. Once diagnosed, what can be done? There's no cure for stiff person syndrome, but there are treatments that can help manage the symptoms. Stiff person treatment. A study published in the Curious Journal of Medical Science suggests there are two main treatments for SPS: GABAergic, gamma-aminobutyric acid therapy, and immunotherapy. For treatment, they suggest starting with benzodiazepines as first-line treatment. Also, it's recommended adding levetiracetam or pregabalin if symptoms persist. Another approach is to use baclofen, which is commonly prescribed to help reduce muscle stiffness and spasms. Some patients also benefit from drugs typically used for neuropathic pain, like gabapentin. These can help with the pain associated with muscle spasms. But medication isn't the only tool. Physical therapy can be crucial in maintaining mobility and flexibility. Occupational therapy can help people adapt to the challenges the condition presents in daily life. Some people find relief through alternative therapies like acupuncture or massage. While these aren't cures, they can sometimes help manage symptoms and improve quality of life. There's also growing interest in using immunotherapies to treat stiff person syndrome. The idea is to target the underlying autoimmune process. Intravenous immunoglobulin treatment has shown some promise in improving symptoms for some patients. But despite these treatments, stiff person syndrome remains a challenging condition to manage. It's chronic and often progressive, meaning it tends to get worse over time. For someone like Celine Dion, this presents a particular challenge. Her career depends on having precise control over her muscles, especially those involved in singing. The unpredictability of the condition makes it difficult to commit to performances or tours. The impact goes far beyond just the physical symptoms. It can affect careers, relationships, and overall quality of life. Celine Dion's case has brought attention to this rare condition, but she's far from alone in dealing with it. While her experience is unique because of her career, many of the challenges she faces are shared by others with the syndrome. One of the hardest aspects for many patients is the loss of independence. As muscle stiffness and spasms worsen, simple tasks can become difficult or impossible. Walking might require a cane or walker. Some people eventually need to use a wheelchair. This loss of function can be emotionally devastating. Many people with stiff person syndrome struggle with depression or anxiety as a result. It's not just about the physical limitations, but also the loss of the life they once knew. There's also the challenge of explaining the condition to others. Because it's so rare, most people have never heard of it. And because the symptoms can be invisible or intermittent, it can be hard for others to understand. But it's not all bad news. Many people with stiff person syndrome find ways to adapt and live fulfilling lives despite the challenges. Support groups can be invaluable, connecting people who understand what it's like to live with this rare condition. Research into stiff person syndrome is ongoing. Scientists are working to better understand the underlying mechanisms of the disease. This could lead to more effective treatments or even a cure someday. One area of research is looking at the role of the immune system in more detail. We know stiff person syndrome is an autoimmune condition, but the exact processes involved aren't clear. Understanding this better could open up new treatment possibilities. There's also interest in developing more targeted therapies. Current treatments mostly focus on managing symptoms. But if we could develop treatments that address the root cause of the condition, it could be a game changer for patients. Gene therapy is another avenue being explored. If we can identify specific genes associated with stiff person syndrome, it might be possible to develop treatments that correct the underlying genetic issues. But research into rare diseases faces challenges. Because they affect so few people, it can be hard to gather enough data for large studies. and pharmaceutical companies often have less financial incentive to develop treatments for conditions that affect only a small number of people. This is where awareness can make a difference. When high-profile cases like Celine Dion's bring attention to a rare disease, it can help drive interest and funding for research. It's worth noting that stiff person syndrome isn't always as severe as Celine Dion's case. There's a spectrum of severity, and some people have milder symptoms that are more manageable with current treatments. There are also variants of the condition. Some people have what's called stiff limb syndrome, where symptoms are mostly confined to a particular limb. Others have a variant that includes symptoms of cerebellar ataxia, which affects balance and coordination. Understanding these variations is important because it could lead to more personalized treatments. What works best for one person with stiff person syndrome might not be as effective for another. One of the most important things for people with stiff person syndrome, or any rare disease, is having a good support system. This includes not just family and friends, but also healthcare providers who understand the condition. Because it's so rare, many doctors have never encountered a case of stiff person syndrome before. This can lead to misdiagnosis or inadequate treatment. Finding a neurologist who specializes in rare neurological disorders can make a big difference. For Céline Dion, her fame and resources give her access to top medical care. But for many people with stiff person syndrome, getting appropriate care can be a struggle. Despite the challenges, many people with SPS find ways to pursue their passions and live fulfilling lives. It might require adaptations or doing things differently, but it's often possible to continue doing many of the things they love. For Céline Dion, singing is her passion. While she's had to step back from performing for now, she hasn't given up hope of returning to the stage someday. Her determination is inspiring, but it also underscores the ongoing nature of the challenge. Managing stiff person syndrome isn't a one-time thing. It requires ongoing effort, adapting to changes in symptoms, and often trying different combinations of treatments to find what works best. In many ways, Céline Dion's experience with stiff person syndrome mirrors that of many people dealing with rare diseases. There's the shock of the diagnosis, the struggle to understand and manage the symptoms, the impact on career and daily life, and the ongoing effort to find effective treatments. In the end, stiff person syndrome remains a challenging and mysterious condition. We still have much to learn about its causes and how best to treat it, but every bit of awareness helps. Every research study, every new treatment attempt, every person who shares their story, it all contributes to our understanding. For now, people with stiff person syndrome, whether they're world-famous singers or not, continue to adapt, to fight, and to hope. If this video helped you out, why not give it a quick like and share it around? It could really help someone else looking after their health. Recognize any of these SPS symptoms in yourself or someone you know? Drop a comment and let's chat about it. If you want to stay in the loop with more health tips, just hit that subscribe button and turn on notifications. We release new videos every week. Your likes and comments really keep us going. They show us what you want to see more of. And before you go, take a moment to check out these 2 recommended videos. We think you'll really enjoy them. Thanks for watching. See you in the next video. Bye.